Hi everyone, this is Giri Srinivasan and welcome to another evidence-packed, insight-rich edition of Physio News Network for the month of June, where we decode the latest research, spotlight clinical innovation and bring physiotherapy into sharper focus. Let's jump into this month's top stories. First research review. Let's talk about the psychological side of pain, especially pain catastrophizing. A review by Sulaiman and colleagues highlights that pain catastrophizing is one of the strongest predictors of chronic disability in low back pain. What does that mean for us in the clinic? It means when your patient says things like,
"I can't go on. I worry all the time if this pain will ever end. There is nothing I can do to reduce the pain."
those are not just emotional statements. They are clinical signals and they are measurable using the pain catastrophizing scale, which includes 13 specific statements like these. When combined with other yellow flags like emotional distress, low self-efficacy and hypervigilance, these patients are at higher risk of becoming stuck in the chronic pain loop. So, what's the key takeaway? Don't just treat the back, treat the beliefs. Now, we'll move on to the second research review. This is for something more mechanical. Let's talk tendons. A recent study reviewed by Dr. Teddy Wilsey has given us a clear tool, the patellar Tendon Loading Index, which categorizes 35 lower body knee dominant exercises into low, medium and high load. This isn't just theory. It's built on kinematic and force plate data. And the winner, the single leg decline squat, showed the highest tendon loading index. Basically, you stand on a declined plate and then you do squats on that, on a single leg. So that showed the highest tendon loading index. That makes it as an essential exercise in mid to late stage rehab for patellar tendinopathy and post ACL care. So that's the two research reviews in this PNN news broadcast. Let's move on to the clinical practice guideline. Today's clinical guideline spotlight, we're going to zoom in on the yellow flags and the timing. Yellow flags about your emotional things. First, emotional distress. Patients may experience high level of anxiety, especially in acute low back pain, or they may suffer from depression, which is more common in chronic cases. These emotional states can significantly affect recovery. So you got to watch out for this yellow flag. The second yellow flag you have to watch out for is hypervigilance. This refers to an excessive preoccupation with pain. Patients may constantly monitor and worry about their symptoms, making it very harder for the body and mind to heal. Then there is pain catastrophizing. This is when patients overestimate the negative impact of their pain. They might think this pain will never go away, which leads to more fear and disability. Next yellow flag is elevated fear avoidance beliefs. This is the inappropriate belief that simple benign activities like walking or bending are harmful to the spine. Avoiding movement, however, can actually make the condition worse. Low self-efficacy is also critical. This is when a patient believes that they have no control over the pain. Helping patients regain confidence in their ability to manage symptoms is very essential for recovery. Another yellow flag is also misunderstanding about the nature of pain. Sometimes patients believe the condition is far more serious than it actually is. This fear can lead to unnecessary imaging, treatments and prolonged suffering. The last yellow flag we're going to discuss about is misunderstanding about the best strategies for long-term success. Some patients believe that passive treatments like someone else fixing their back are the only answer. But research tells us that active treatments like exercise and self-management are far more effective in the long run. By identifying and addressing these yellow flags early on, we can create better outcomes for our patients and we help them to get back to the life they love. So this guideline emphasizes a crucial point. Fear avoidant beliefs don't always show up on the first visit. They often emerge later, especially during the return to work or return to play phases. When patients are faced with tasks, they are afraid to do so. So don't stop screening after the eval. Tools like FABQ, Tampa scale or pain catastrophizing scale should be revisited as the rehab progresses. Be ready to listen, not just for pain, but for fear. Now, let's talk about innovation. Today's innovation spotlight. This month, we are spotlighting a tool that's gaining serious traction, especially in concussion recovery, whiplash, and sports neck injuries. It's called the Iron Neck. This dynamic resistance device strengthens deep cervical stabilizers, trains multi-planar control of your neck, and addresses neck dysfunction in a safe, progressive way. From linemen in football to patients post-MBA, the Iron Neck helps retrain head-on neck coordination, reduce dizziness, and also improve neck strength. This is Rehab redefined. This Iron Neck really helpful for all our patients in the neck rehab. Next, exercise of this edition. Now, for our featured move of the month, half kneeling chop. I love this exercise, the half kneeling chop. It's simple, it's sneaky hard, and it's incredibly functional to improve your dynamic hip stability. So you are in a split stance, one knee down, one foot forward. From a high cable or a band, you chop diagonally across the body, right? You can go both ways, engaging the core, shoulders, hips, and obliques. You make sure your feet are positioned kind of one fist away from each other, not too far. Okay, this exercise is great for anti-rotation control, postural training, and bridging the gap between rehab and performance. Start slow, focus on postural control, and focus on stability and cue control throughout the range. And make sure you breathe. That's very important. A lot of our patients, they do not breathe. And this is my go-to exercise for the dynamic hip stability. We teach all our lower back patients and hip patients on this one. Next, we'll move on to the success story. A story that reminds us why do we do this work. Meet Sarah. Sarah came to us after 2 years of chronic lower back pain. She felt helpless. She believed her back was broken and her pain catastrophizing scale score was off the charts. But through current pain neuroscience education, movement-based therapy, and fit-for-purpose model approach and belief reframing, she actually found her way out. 12 weeks later, she's back at work, moving with confidence, and hasn't had a flare-up in 6 months. Because sometimes the biggest win is not strength or flexibility, it's belief, your belief in recovery. And that's all for this month on Physio News Network. If you like this, please share and subscribe with your friends. Let's help each other. Whether you're loading tendons, reframing beliefs, or training the neck in 360 degrees, remember this. Behind every diagnosis is a human, and behind every successful outcome is a therapist who listens, thinks, and adapts. I am Giri Srinivasan, registered physical therapist. Thank you for watching, and I will see you in the next edition of PNN. Stay strong, stay evidence-based, and stay moving. Bye.